Hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is all about the pandemic prevalence of hypertension, which is giving a lot of burden to our cardiovascular health. Yes, so for this discussion, now I welcome Dr. A. Guru Prakash Garu, who is our senior consultant interventional cardiologist at Yashoda Hospital, Somajigoda. I welcome you, sir.
Yeah, hi madam. Happy to
Yes,
join
sir.
you. So we'll
Yeah.
have a lively discussion now. So any
Yes, sir.
questions, I'm ready to answer. Go ahead, madam.
Yeah, and
Yeah.
yeah, thank you, sir, and we are privileged and honored to have you with us today. And can we see you, sir, at the same time, or you're driving yourself, sir?
I'm driving. Yeah, okay, I'm live, no problem. I'm driving
Yes, sir.
right now.
Yes, sir. Yeah, yeah.
I'll reach
And
hospital in 5-10 minutes, madam. No problem.
yes, sir.
Go
Yes,
ahead.
sir. Yes, sir. Yeah. And I now like to request all the speakers to introduce themselves. Yes, over to you, Divya.
Okay, good afternoon, sir. Good afternoon, ma'am. Myself, Divya Jyoti. I'm working in OT as a nurse manager.
Yes, Glory.
Yeah, good afternoon, everyone. So myself, I'm Glory Selvam. So I'm basically a nurse. I'm a registered nurse, and I work as a senior L&D department trainer. Thank you.
Oh, L&D is again, you mean to say learning and development?
Yeah, development. Yes, ma'am.
Yeah, it sounds good. Yes. We do have Mr. Teja. Yes, sir, Teja, over to you.
Good afternoon, all. Myself, M.J. Teja. I am working as community health officer in Sri Satsai district at the basic community level.
Thank you, everyone, for this beautiful participation. And I like to thank Teja also because he's doing his field survey and at the same time he's contributing for the webinar. Yes. Now, first, we would like to understand from Guru Prakash sir. Sir, are you there?
Yeah, I'm there,
Yes.
madam. No problem.
So yes, sir. This is let us start with little of a number or prevalence. Like, as we all want to understand, like, is it rising number of blood pressure prevalence high currently?
Yeah, madam. It is now. So it's as
Is
you
it?
aptly told, it's almost a pandemic.
Yes.
The hypertension, if you take the incidence and prevalence of hypertension, in urban population, it's around 20-25%. In rural population, it's around 18%. It's constantly rising from the past few decades.
Yes, yes. And it is quite a very huge number, sir, and it is multiplying further.
Almost 20-25% is every 1/4, 1/5 of the patient has hypertension.
Yes. So yes, now going forward, we'll also like to involve all our speakers because they are from different facility and setup, and they will always like to learn from you, sir. Yes.
Yeah.
Over to you, Glory, for your insight. What you would like to ask from our expert, who is Dr. Guru Prakash, sir. Yes.
Yeah, thank you, ma'am. Yeah, like, it's very shocking to know that 1 in 3 to 4 conditions are like hypertension. So I wanted to know, doctor, so how many of the patients who are coming to your clinic are with uncontrollable and non-controllable and controllable hypertension?
Yeah, you mean to
Yes. Yeah, madam. So you mean to say out of 100 people, how many people have with the treatable? I mean, with the medication, they are treatable, and with the medication, despite the optimal medication, they are not treatable. I mean, the control, the BP is not under control. That's what you would like to mean? Yeah. See, I would like to say in hypertension prevalent population, basically it's awareness. So if people are aware of the long-term effects of the hypertension who are on regular medications, BP is under control in nearly 50-60% of people. This after taking regular medications and they check BP well and all. Suppose if they are not on proper medications, people think that they're not in, so they don't have much problems if they have hypertension. But the mindset of the people differs. See, some people think that though they have diabetes, hypertension, coronary disease, is nothing going to harm them in the long term. Such kind of people will be at least 1/3, 1/3 to 1/4, and for them it's very difficult to treat.
Yes.
And there are a very small subset of people, despite optimal medications, like especially in CKD people or who have multiple risk factors like diabetes, dyslipidemia, or elderly population like 70, 80 age group, no? They have thick atherosclerosis. For this
Yes.
age group, despite optimal medications like 2-3 drugs, if you have resistant hypertension, by definition, it's called people who are on more than 3 or more drugs. Still, the BP is not controlled. It's called resistant hypertension. Such category are common among CKD, people with chronic kidney disease, and
Yes.
elderly population like 70-80 age group who have multiple risk factors. So such people is very difficult to treat, madam.
Yeah, yes, and very rightly, as you said, and we have come to know also that there is a one word called resistant hypertension as well. Yes. So we
Yeah, it's
also
called,
have a
by
miss.
definition, it's called people who are on 3 or more drugs.
Yes.
Still, the BP is not under control. Like the targets are 140/90, right? Or
Mhm.
139/80. If they are not
Yes.
controlled, there is a separate approach for them. So we need to
Yes.
add new drug, one more additional diuretic called aldactone and other
Yes.
vasodilator called hydrolysine. They are the people whom they require. And now renal denervation therapy has come in this population. Means
Yes.
the in the renal artery you denerve them with a catheter, EP catheter.
Yes.
So
Yes.
then the autonomic, usually the BP is very much uncontrolled because of the hyperactive autonomic nervous system in this group of people. So when you do such modalities, obviously the BP chance of controlling is very high.
And they get better. These groups get
Yeah,
better.
yeah, yeah, yeah. So in our
Yeah.
hospital, Yashoda, we have such facility. In
Yes.
I think we have done around 4 to 5 such cases. People have very good results with those kind of
Results, and they
modality
are
of treatment.
continuously following up.
Yeah,
Yes.
yeah,
So
yeah.
yeah, aldactone again, it is a potassium sparing diuretic, sir. Yes, and
Yes,
hydrolyzed. And
yes.
as you told, I'm just noting it down, renal denervation therapy.
Correct,
Yes.
correct, correct.
Yes. So we also have Mr. Teja, who is a community health officer from Sri Satya district from Andhra Pradesh, and rightly he is on the field doing his survey for NCDs among 18
Yeah.
years age group. Yes, Teja, as sir is here with us. What kind of what kind of age group you see when they come to your clinic, like as you are a community health officer posted at community level? Yes, over to you.
Yes, ma'am. Thank you. Doctor, can I know why these teenagers are getting more diagnosed with the hypertensive cases? Because what?
Yeah, that's true. That's true. Majority nowadays, even we are finding hypertension in
Among
younger
children.
population, below
Yes.
35 age group, even teenage people we find. So this people persons, there's a separate term called hypertension in young. So people who
Yes.
are younger age group and still they have hypertension, we need to rule out a condition called secondary hypertension. So there is
Yes.
a primary
Yes.
hypertension, and there are two types of hypertensions. Primary
Yes.
hypertension is people who have hypertension at the age of 40, who have family history of hypertension, whose lifestyle is not that good. So in secondary hypertension, it especially affects this engaged group below 16, 19, 20. They may have conditions called renal artery stenosis. This is one of the
Yes.
common conditions. Renovascular hypertension, it's called. They have bilateral renal artery stenosis. Okay.
Yes.
So if they
Yes.
have bilateral inertia, the renin-aldosterone mechanism in such
Yes.
population alters, and they tend to have hypertension at very young age. That is one of the
Yes.
common causes. And
Mm.
other causes are aortic. This thing. There is a condition called coarctation of aorta.
COA. Yes. Yeah.
Yeah, yeah. So when these people by genetically they have a narrowing of the descending aorta. So in such people, the renal arteries and all the kidneys receive less blood flow. They
Yes.
increase the renin. They activate the renin angiotensin mechanism, leading to higher up BP. Okay.
Yes.
There's another
Yes.
condition called Takayasu disease. So it's common among
Takayasu
young
disease.
females.
Yeah.
Yeah,
Yeah.
Takayasu disease. So
Yes.
this people, the reason for this Takayasu is not well known, but they have a narrowing of most of the arteries, especially the aorta, the main branches of the aorta. Then they have very high BPs at the time of presentation. It's common among young teenage females.
Teenage females. Yeah. Yeah. Great insight. And we have also Jyoti. Yes, Jyoti, over to you. Like, yeah, self detections. You would like to ask about how to detect self, BP control measures. Yes, over to you.
Yes, ma'am. Sir, how to understand or self-detect that blood pressure is not okay or it affects that heart health? And how
Yeah, yes, that's a very good question, madam. Usually the BP, people who have primary people, like after 40, 45 people, majority people tend to get BP, right? Such people, even it is asymptomatic most of the time. 90% of the
Yes.
times, they don't experience any symptoms. Okay.
Yes.
Some of the
Yes.
symptoms which people have is headache, the posterior side of the head, the back of the head, no, they have nape of the neck, they
Yes.
have, tend to have headache, and then giddiness, kind of a heaviness in the head. These are some of the complaints. These 10 to 15% people complain. So most of the
Yes.
time, it is no symptoms. Okay. Then
Yes.
how do you detect? That was the question. So when
Yes.
you, we need to have a frequent checking of this particular BP. See, people who are 35, 40, I advise always they should undergo basic health checks. Like
Yes.
get a blood pressure recording. And when you record for the first time, and we should do it in both the hands. See,
Both the
you know what?
hands.
Some people, yeah, both the hands. That's one of the
Yes. Yes.
precautionary, this thing people should have it. Otherwise, they.
There will be a deviation, you mean to say? Yes. He will join very rightly, and yes.
Yeah.
Yeah.
So this is one of the main. So once you check only, you will come to know that you have hypertension, madam.
Yes. Yes.
Hello.
And periodically they should
You
keep checking. I think it is good to
you
document
could
your
get
own
the
reading and
any. Yeah. Yes. 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 Yes.
yes.
Yes. Yes.
Yes. Yes.
Yes. That's how it is.
Yes.
Yeah.
Yeah. Teja, Teja wanted to understand the treating modalities, hypertension, early screening tools in our hospital. Like as you were mentioning, like PP monitors are very, very validated devices we have now. Yes, Teja?
Yes, ma'am. Sir, even though we are going with the normal screening with the invasive screening of PP, but we are unable to detect the correct person of the, I mean, 100% accuracy of the hypertension. Even though our routine follow-up cases also, we are going the same cases, but
Yeah.
the slight changes in the
Yeah.
BP is more regarding to normal people. What would be the reason? Whether we have to change our strategies of screening, or we have to, is there anything new interventions to detect the hypertension other than this invasive method, BP?
See, for routine BP measurements, the best one is clinical recording. See, like clinical recording in the sense, either a doctor or nurse checks the BP on
Yes.
both the hands.
Yes.
See, recording on both hands is very, very important. Sometimes people who have stenosis of the subclavian artery on one hand can have a very low or normal recording of the BP, despite they have BP, high BP.
Yes.
So recording on both hands, that is the primary thing, and that's the best way. See, there is another method called invasive recording. I don't recommend for any routine clinical management. See, there is invasive recording is like you puncture the red blood, which we do in acute
Yes.
medical setup, AMCs. So you puncture the radial artery and directly record the BP. This is supposed to be very accurate, but I think for routine day-to-day practice, we don't recommend that.
Yes.
So
We don't
ideally, maybe checking our BP by both the hands, that should be fine, more than enough. Most of the times you pick it up. Provided your BP apparatus is good and the person who is recording knows the technique of BP recording.
The fundamentals of, yes.
That's it.
Yes. Nowadays
People
it is
I've seen many youngsters and nurses that we need to follow that 5 steps. See, there's a tapping, muffling, that
Yes.
all those BP recording should be perfectly carried out.
auscultation, yes, method,
Yeah,
all
yeah.
what,
Other
yes.
people don't. They stop at muffling and then don't record. That's how it is.
Yes, yes. Very rightly, as you said, and yes. So, do you also recommend the children's like below 18 years for screening strategies? Should they also check the BP apart from, you know, as you were saying that pituitary involvement, hyperaldosteronism
Yeah.
is seen,
Yes, yes.
all that.
So, yeah, there are, see, if you are suspecting basing on their symptomatology, young population,
Yes.
ideally better check it up, madam. For routine day, every teenager, we usually don't recommend. Suppose the condition, clinical condition recommend. Suppose a patient is suffering with a nephrotic syndrome or a nephritic syndrome or a pituitary, I said, aldose, hyperaldosteronism. Obviously, they should get it checked.
Yes, yes. Yes, Divya. You were asking a little target to BP and yes.
Yes, ma'am. Sir, what is the primary goal for managing normal blood pressure?
Madam, this is a very
Especially
good question. There is a recent update, AHA guidelines on this, maybe as recent as 2 months back.
Yes.
See, ideally 140/90 is the upper limit. Beyond that, you are supposed to treat. Okay. So you can take it. There are two targets nowadays. One is 140/90 for a people who have very less risk, only hypertension is there.
Yeah.
People who have coronary artery disease, people who have kidney disease. And there is a new thing, calculator called prevent calculator. Note it down, prevent calculator.
Prevent calculator.
Prevent calculator. That has come as early as latest as 2 months. So this prevent calculator has multiple so it has got multiple parameters like age, HDL, this thing, and presence of coronary artery disease, presence of CKD, all these things. So they have taken, they have given points for each one. So if it is more than 7.5, the score is more than 7.5. The criteria should be less than 138. Got my point?
Yes.
So if the scoring is like, suppose patient has very low HDL, patient has CKD, patient has coronary artery disease, age is more than 65, the score will go up, eventually go up more than
very risk,
high risk group. Maybe
high
you can
risk
call
group,
it.
yes.
Yeah. For such group, you need to keep a target of 130/80 less than that. Yes. Person who have a less than 7.5 score, the target is 140/90. This is the recent guidelines that has come up.
So prevent calculator, is it a in a form of device or anything?
It's available as an app, madam. It's available online.
Oh, it is an app, yeah.
You can type in prevent calculator, it will come as it.
And you got to feed all your data and then it will give you the ultimatum of
scoring
your
it will
own
give
score.
automatically.
Yeah,
and if it's more than
75,
7.5, you're supposed to.
So yeah, this is a very creative publishment which is done by AHA and to prevent the And yes, Teja, I will like to understand from Teja also what kind of tools you use at your community setup. Like as Sir was saying, nowadays a lot of digital tools and technologies have come into the hospital and tertiary care centers. Yes, like what education do you give if you see a person who reports to you and one rise of systolic pressure, and after that what health literacy do you provide? Yes, over to you.
Ma'am, actually, we advise them the DASH diet so that directly approach to stop hypertension. So in that case, we will explain about what food we have to eat, at what quantity we have to, iodine salt should be used in their regular meals. And there will be a regular screening, ma'am, for them, those who are symptomatic now. So we will go to house survey and we will make each patient monitor the BP so that a correct target evaluation will be taken. There will be proper assessment of this patient will be recorded in it digitally through the apps what we have given with the central government regarding the NCD CD surveys. So we'll go through the surveys first, and then we will make the patients to come to follow up again. So whether they are yes, ma'am, whether they are whether there is any physiological changes in the blood, or whether they are having any symptoms arises abruptly. So in that cases, we will make them to refer to the higher levels, ma'am.
Higher level, yes. So again, Divya and Glory, do you have anything to be asked to Teja? Or because I have a question to be asked to Teja. Why? Because how do you do you see this digital devices at rural level, like when you do house to house survey? Do you see them buying these devices and monitoring their own blood pressure, Teja?
No, ma'am, some those who are having financially fit, they are undergoing
They'll
self-care,
mind,
ma'am.
yes.
Yeah, but mostly 70 out of 100, mostly 70% of people, those who are in rural level, they can't afford the digital BP apparatus. So for that case, in rural, we are going to do 100%, ma'am. So even 100% screening will be done to the community people. Those who are, I mean, maybe there will be chances of absentees or either they went for any other village. So we will track them through the UHID, so that we after that tracking only will make them to the
Okay.
screen, and then after screening we will go to the prompt treatment, ma'am. So referral
Yes.
or through any signs of symptoms, whether they need any follow up or something cases, we will go through it, ma'am.
Yes, very great. Because the preventive aspects are not only in the tertiary centers, even district public health sectors and community sectors are also taking place. Yes. Yeah. So I was just going through your lot of blogs and all, sir, and suddenly it is reminded to me that does anxiety in the form of stress affect
Yeah.
CV health? Yes, Glory,
Yes,
are
ma'am.
you there? Yes.
Yes, ma'am.
So, sir, yes,
So I
sir,
want
I
to
think,
know.
yeah, you can
Yes.
ask after that, sir will answer about this. Yeah.
Yeah, go ahead, Glory.
Go
Yeah, sir.
ahead,
Like
Glory.
I have a doubt with the previous topic, sir. So like I see most people are opting for the digital BP apparatus, but when we
Yeah.
compare with the
Manual.
sphygmomanometer, there will be nearly like a 10 to 20 mm of HD difference is there. So I want to know whether it is reliable to use a digital in a
Yeah,
daily basis.
that's a good practical question, madam. Actually, ideally, manometer is the best one. But
Yes.
sometimes to make it easy or make it convenient for, suppose a person who don't know to record the BP manually, I mean this through manometer. Again, digital recordings are not bad. BP apparatus, I've seen many of them. I compared with them. So maybe on 5% difference, maybe less than 10% at the max. That's but its convenience is there. Suppose a layman who don't know, who don't have strength, who don't know any basics of BP, manual recording, they obviously can use digital. More or less
Yes.
for a home monitoring, it is decent enough. 5% difference doesn't make much difference. It may
Yes.
not be as accurate as sphygmomanometer, but it's
Like manual
practically okay.
BP. Yes.
And how often do you think, sir, the people have to go for sphygmomanometer checking, even though they have digital at home and they are
So,
regularly checking?
suppose despite their BP optimal medical management, still the BP is still high. Let them cross check
Okay.
with the sphygmomanometer. If they are not, I mean, if it is well controlled sphygmometer, the digital meter should be discarded. I believe.
Okay.
Yes.
Thank you.
So we have we are nearing to the end of the discussion, as my question is again the same, like you were mentioning about catecholamines, which is a very great hormone in the
Yes.
body. Does anxiety in the form of stress affect CV health? Yes, I saw your reels.
Yeah,
Yes.
madam,
What
that's a
is?
good question. Thing is, uh, stress affects every part of the body. You can take
Yes.
name any part of the body, it's affected. So BP is one of the commonly thing that affects. See, in stress and anxiety, what happens is there are so many hormonal changes, like your
Yes.
catecholamines, adrenaline goes up. These are called pressure hormones. When catecholamines
Pressures.
and they press on they give a good cause a vasoconstriction of all the arteries, major
Yes.
arterioles and all. So when there is an increase in pressure, so during that time, obviously they have a higher pressures. So anxiety, see, one of the commonest cause for hypertension is lifestyle. It's a basically
Certainly.
lifestyle disease.
Yeah. Yeah.
So people who have anxiety, stress, obviously they have high blood pressure. So for anyone who comes to me with initial hypertension, for the young person, usually I say them, so you change your lifestyle. I don't start on medications.
Yes.
So at least 10 to nowadays, even up to 150, 160, you don't start on medications. You should give them an option of 2 months of lifestyle modification. See,
Yes.
lifestyle
Yes.
modification includes the low salt diet. The salt should be
Yes.
around 6 to 8 grams, not more than. In our Indian, this thing they say we use around 20 grams. So
Yes.
see,
Yes.
make them less about 8 grams, around
Yeah.
6 to 8 grams. And then have at least 7 to 8 hours of sleep, 30 to
Yes.
40 minutes of exercise, I mean, just simple walk and stress-free life. And
let them record the BP for a period of
Yes.
at least a week or 2 weeks, and then after 2 months, let us see. So most of the BP will come down. I see young population who have this entrance exams like NEET, or they always mostly have high BP. So I tell them, just don't worry, let your exam gets over. After that, your BP naturally come down.
Will come down. Yes, yes. So yes, I think this topic is very nice topic, and this 15 or 20 minutes of time is not enough to understand
that's
about
true.
this. Yes, and so I have my doubt. Like, do you recommend the iodized white salt or pink salt? So I am also confused because whenever I go to market, what do I buy?
Madam, actually, whenever a medical person talks about which is superior, we need to have a clear-cut data. See, evidence-based. Everything what we talk, see, we are giving ACE inhibitors, ARBs for hypertension. We have a evidence. We studied in so and so people, and there is evidence. So there is no such evidence as such which is better. It's more of a marketing. Maybe some differences may be there, but it's not clinically studied which is better. In an authentic way, it is proper way, it is not straight. So we are also in a
We
darkness
have
which
no,
is
yes,
better.
yes. We just cannot
Yeah, we
publish
have to use and try which is better. That's all.
Yeah, yes.
No books are
So,
mentioned which is better.
yes, thank you everybody for your valuable time. Thank you, sir. Though you were engaged, but then you contributed, and
Thank you very much, madam,
yes,
for involving me. I was a little late
thank you.
because I was
No,
driving.
it's okay, sir. It's no problem,
Thank you
sir.
so
And
much. I hope my
thank you.
discussion has added
Yes, sir.
benefit to your
Yes, sir.
knowledge.
We'll again,
Yes, sir.
we urge all the participants to, share as much as you can, and refer to our website www.yashodahospitals.com for more update, because I keep seeing, and these updates are all short in a form of very short reels. I saw the anxiety reels. I saw how a heart attack or acidity differences can be, just to give the awareness among the public, and regarding the green tea and coffee beverages, how it can just this is nothing but killing about the myth and facts about, right? So yes, we end the session. Thank you, Gloria. Thank you, Divya. Thank you, Teja. And thank you, sir. And we end the session.
Thank you, Shanti madam, for adding.
Thank you. Bye.
Thank you, sir. Thank
See,
you,
we will
ma'am.
meet
Thank you,
again for
ma'am.
some other topic.
Yes, sir. Yes, sir.
Bye-bye.
We did.
Bye-bye.
Yes, sir. Thank you,
I'm
sir.
leaving.
Thank you.
Thank you.
Thank you, sir. Thank you.